Dr. Chad Domangue is with us, an interventional neurologist and pain management specialist. You know, he admitted himself for inpatient treatment, but what are some of the symptoms that would cause a doctor to recommend this for depression?
So when you're dealing with depression, I think it's good for the viewers to understand the difference between pure depression in regards to a psychiatric illness versus depression related to medical comorbidities. So I think in the center situation, you have a little bit of both. So in a pure psychiatric setting, you would admit someone if they are at risk to harm themselves or harm others. I think in a medical situation, which plays more to the senator, he has an underlying heart issue. He has an underlying stroke issue. So his depression could be a manifestation of underlying medical comorbidity. His heart's getting worse. He could have a thyroid problem. He could have a frontal lobe seizure. So not all seizures do you actually move. So a depression could be a sign of a seizure. So succinctly, when I hear this story and I hear his depression's getting worse, as a physician, it makes me concerned that other medical comorbidities could be worse. It could be a medication side effects. Propranolol, a very common drug used for heart issues, can cause depression.
And you know, while we either have personally or we have someone we love greatly fighting depression right now, this fitness for office, it was a big talking point leading up to his election and the debate where we saw him here in studio at NewsNation with Dr. Oz. But he admitted his clinical depression spiked in recent weeks when he took office. Does this, as a medical doctor, say to you, we need to have a conversation about how much time you can spend in office, what you are doing on a daily that might contribute or exacerbate your health?
It's a good conversation, you know, just to be clear, we don't know all the facts. I mean, as a medical doctor, you know, I need to review his chart. What does his heart function like? What type of stroke he had? You know, there's a lot of elements to that. But I think your point's well taken. I mean, look, you know, since he's entered office, he's got a lot of medical issues going on. And so outside of depression, how is his heart doing? You know, what is his risk for another stroke? How is he handling the medications that he's taking? And some of the articles that I've read, he's becoming more withdrawn, you know, so that's a very problematic symptom. So I think, you know, right now there's just a lot of information that we don't know, you know, on the outside looking in, but I'm sure his physicians are looking at all of this, his medications, his brain function, you know, MRIs, EEG, his cardiac function, you know, they're looking at him as a whole instead of just he's having worsening depression.
And again, it really is something that he's been in the hospital just the past few weeks for depression, but also for lightheadedness, dizziness, and then, of course, that stroke back in May. Let's talk about another big name in the news in regards to health, actor Bruce Willis. He has his own battle, his family updating fans on his condition. They've issued a statement saying, in part, Bruce's condition has progressed, and we now have a more specific diagnosis, frontotemporal dementia, known as FTD. Unfortunately, challenges with communication are just one symptom of the disease that Bruce faces. So what is frontotemporal dementia?
Yeah, very unfortunate story. You know, I heard the aphasia a year ago. This is kind of what I feared. I was hoping it was just a sign of a stroke or something else, but obviously we know differently. So I'm going to compare it to Alzheimer's. So I have my brain here. So in Alzheimer's disease, the disease process starts on the inside of the brain and then works its way on the outside. So this is the frontal and the temporal lobe. So FTD, it's opposite. It starts on the outside, goes inside. We call it dementia, but the thing that's interesting about FTD, the memory issues are towards the end of the disease. So the beginning of the disease is aphasia, I can't speak or I can't understand speaking, or frontal lobe issues, which is impulsive. So eating too much, hypersexual, inappropriate, what we call frontal lobe symptom. There are stories of people with FTD that present, unlike Bruce, with aphasia that are just eating too much. So they're gaining weight because they can't control that ability to eat. It's a very severe disease, but again, we don't see as much as the memory issues. And the other thing with the FTD diagnosis, they don't have the insight. So they're not aware they have this problem, which makes it very problematic for family and caregivers taking care of somebody with this disease.
Dr. Domangue, thank you. And again, Bruce Willis, only 67 years old, very young to be facing this. We appreciate your time.
Oh, absolutely. Thank you, guys. Appreciate it.
Absolutely.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.